Hello, my friends. It's Dr. Sharon with Clinic Reviews. Today we're talking about CVA and TIA. CVA is cerebral vascular accident, and TIA is transient ischemic attack. Stay tuned. Hello, Clinic Review family. It's Dr. Sharon with Clinic Reviews. I'm so glad you're here with us today. I don't know where you're at. I don't know what time of year it is for you, but where I'm at, it's sunny and beautiful today, and it's Fahrenheit. It's probably in the low 60s, which is absolutely gorgeous. Having a great day. My dogs are happy, so I'm feeling good. Hey, we're talking about CVA. It's in the Blue Book. The Blue Book is right there behind me. You can order that at Amazon, or you can get the app. If you go to clinicreviews.com, you know that this channel is a part of the greater Clinic Review family. The greater Clinic Review organization was founded by Mark Klimek a long time ago, 40 years ago. And he started an NCLEX review. It's based in his way of thinking, and he thinks in patterns. So it is a very, very unique NCLEX review, y'all. It's phenomenal. I don't know if you've noticed, but he does not do any advertising. So if you found this, it's because somebody else recommended it to you. If you found Clinic Reviews and he determines whether he's successful based on how many people purchase his product, because he believes advertising is sort of manipulative, right? It can be quite manipulative. So he does this NCLEX review that is phenomenal. It's widely regarded across the United States and even in other countries. So I do recommend it. Go to clinicreviews.com. You can get the online on-demand program. This channel does not cover what we talk about in the actual Clinic Review, the NCLEX RN or PN review. Okay. So we have also small group tutoring that you can purchase on a monthly fee, or you can do our streaming service. So today we're going to be talking about CVA and TIA, cerebral vascular accident. Cerebral, okay, that's brain. Vascular, those are vessels. Accident, something happened, right? So CVA is a stroke. TIA, transient ischemic attack. Transient means it comes and goes. Ischemia means lack of oxygen. Attack, you know what attack means, transient ischemic attack. So a transient ischemic attack is where you have a lack of blood flow to the brain, and then it reperfuses. So it loses perfusion for some reason, and then it reperfuses. A CVA, a cerebral vascular accident, is not transient. It's not transient. So it's a lack of oxygen to the brain. And because of the lack of oxygen to the brain tissue actually dies. And depending on where the tissue dies will depend on the limitations you have. If it dies in the speech part of your brain, then you're going to have trouble with speech. If it dies in the motor part of your brain, you're going to have trouble moving. The other thing to remember is that it's usually just on one side or the other. And the left side of the brain controls the right side of the body. The right side of the brain controls the left side of the body. So if they have a right CVA, their usually deficits are on the left side. If they have a left CVA, it's usually deficits on the right side. Now, there's really two types of CVAs. There's hemorrhagic and ischemic. Now, both of them end up with poor oxygen to the brain, but hemorrhagic is a result of a bleed, right? So it's not getting there because it's bleeding out. So that's a hemorrhagic. That happens in the brain itself. An ischemic CVA or ischemic stroke is when there's a blockage of blood somewhere. So a thrombus, a thrombotic stroke, is when you have usually a thrombus somewhere here. You have a blood clot occur, usually somewhere in the carotid artery, maybe a little bit higher up, but it's somewhere in here. Then there's an embolus. Embolism is also a clot somewhere in here, but an embolism is a clot that's moved from somewhere else. So maybe they had a DVT and that clot's part of it broke off. It traveled up into the brain or into the carotid artery area somewhere, and it's an embolus, and they end up having an ischemic stroke because of that. Remember, hemorrhagic strokes not a lot we can do about them. You want to stop the bleeding, but it's not like you can put pressure on the brain, right? So a hemorrhagic stroke is a little bit difficult to stop. Hemorrhagic strokes are less common than ischemic strokes. Ischemic strokes are much more common. Ischemic strokes, they can actually give clot busting drugs like TPA. TPA will go in and break up the clot. Okay. And so that's why stroke alerts are a big deal now. So somebody comes in with a stroke alert to the ED, they have to get within an hour, they have to get a CT of the head to see what's going on. And if they can see that they have a thrombotic stroke or an embolic stroke, they have to do TPA. They have to do clot busting drugs. All right. If you notice that my camera seemed to be jiggling, it's because my dog was eating his bone right next to the camera stand and he was jiggling it. So sorry about that. All right. So that's sort of the introduction to stroke, CVAs. And now we're going to go ahead and do some questions to help you better understand the problem and how it can be asked on the NCLEX. A 65-year-old male with a history of hypertension and atrial fibrillation arrives at the ED exhibiting sudden onset of right-sided weakness and slurred speech. So immediately I think stroke. Which of the following interventions should the nurse prioritize within the first hour of arrival? Well, I just told you the answer to that. So the problem is they have a history of hypertension, which can cause atherosclerosis, and they have a history of AFib. So they could have thrown a clot, right? Or they could have a narrowing in the carotid artery that could cause a thrombus, or they could have an embolus from the AFib. And then they have symptoms of stroke. So I think, okay, this is a stroke alert. What do I have to do immediately? Prepare the patient for immediate carotid endarterectomy. Carotid endarterectomy is where they go and they clean out the clot and the plaque. And no, I don't know that's the problem yet. I don't have enough information. Administer TPA. I don't know. I don't have enough information to do this yet. Assess the patient's blood glucose level. Maybe, I'm sure some part I want to do that. Obtain a CT of the scan of the head without contrast. That's what has to be done within the first hour. And then if they get that done and they see that they're having a stroke, then we're going to either plan probably TPA, probably not going to rush them for carotid endarterectomy. I mean, I suppose they could, but that's less likely than to have like a TPA. Patient is admitted with a transient ischemic attack. Remember, transient means comes and goes. Ischemia, lack of blood flow to the brain. Which statement by the patient indicates correct understanding of this condition? Since this wasn't a stroke, I don't need to worry about lifestyle changes. Well, it's like a pre-stroke. A lot of times patients will say, I had a pre-stroke, or the doctor may call it a pre-stroke. It's a warning that a stroke is coming. So that's not really true. A is not true. A TIA is a warning sign that I might have a stroke in the future. All right, I just said that's what it was. So B is definitely true. My symptoms were caused by bleeding in my brain. Well, that's very unlikely because it wouldn't be transient if it were bleeding in the brain. So it probably would have been a full-blown stroke if it were hemorrhagic. And we don't have enough information to say that anyway. I will need surgery to remove the clot causing the TIA. We don't know that yet. We don't know what's causing the TIA yet. So and let me read the question. Which statement by the patient indicates correct understanding? So I'm looking for the true statement. So B is the true statement here. A TIA is like a warning sign that they're going to have a stroke. All right. A patient with receptive aphasia is struggling to understand instructions. What is the best approach for the nurse to enhance communication? All right. Receptive aphasia. Aphasia is difficulty talking, but receptive aphasia actually isn't really aphasia in the strictest sense of the term. Aphasia is difficulty talking, but receptive aphasia is difficulty processing the information. So they can talk okay, they can use words okay, and they can put sentences together, but they don't understand what you're saying to them. So a lot of times what they say in response to you doesn't make sense because they misunderstood what you said. They can't process what you said. So it is a verbal speech processing problem. All right. So what is the best approach for the nurse to enhance communication? Use complex sentences to stimulate comprehension. Repeat instructions in the same way each time. Write down all instructions for the patient. Use short, simple phrases and check for understanding. All right. Receptive aphasia. So I'm going to cross off A because complex sentences is definitely out. Repeat instructions in the same way every time. Well, if they don't understand what I'm saying, why would I just keep repeating the same thing over and over again? That doesn't make any sense. So I'm crossing off B. Write down all instructions for the patient. Well, they have receptive aphasia. Can they interpret words on a page better than they can interpret spoken words? That I'm not completely sure if that's true or not. Use short, simple phrases and check for understanding. So if someone has receptive aphasia, they have difficulty processing, would it be better if I use short, simple phrases like no or start here, do this first, and check for understanding? So if they're having trouble processing what I'm saying, it seems like using short, simple phrases to check for understanding would be better. Now, again, I'm choosing an answer that I know is a good idea rather than the one I'm not sure about. So I may say to myself, I don't know if written is the same as verbal. So if I don't know, why would I pick it? Unless there's absolutely no other answer that makes any sense at all. If no other answer makes any sense at all, then I can pick the one I'm not sure about. But if I know D is a good answer, why would I pick C over D? That doesn't make any sense. So I'm going to pick D. Which patient is at the highest risk for an embolic stroke? An embolic stroke is a clot that moves from somewhere else. A 50-year-old with uncontrolled hypertension, a 60-year-old with atrial fibrillation, a 45-year-old with a history of cerebral aneurysm, a 70-year-old with carotid artery atherosclerosis. So carotid artery atherosclerosis is a high risk for thrombus. So what happens when you have a narrowing of the artery, the blood slows down as it goes through there, and it can clot as it goes through there, okay? So that's one, that's not embolism. A 45-year-old with a history of cerebral aneurysm. My dog is leaning on my light again. All right, I'm going to have to hold my dog's bone over here so he doesn't keep moving over to my light. All right, a 45 with a history of cerebral aneurysm. So an aneurysm is a risk for a bleed, not for embolism. Okay, so if they had a cerebral aneurysm, I'm like, uh-oh, that thing's going to burst and they're going to bleed out. So that's not an embolism. 6-year-old AFib, that's clot. They could be throwing clots in their heart, which could travel. That's an embolism. 50-year-old with uncontrolled hypertension. I mean, certainly they're at risk for a lot of stuff, but not an embolic stroke so much. So the correct answer's got to be B. The nurse is educating a patient about modifiable risk factors for stroke. Which factors should be included in the teaching? So modifiable. So I want to make sure you know the difference between modifiable and non-modifiable. Modifiable risk factors are things that can be changed. Non-modifiable cannot be changed. So what are some risk factors? Well, all the same risk for stroke, all the same risk factors as for heart attack and peripheral arterial disease, all that stuff, all the same things, okay? So smoking, yes, that's a risk factor. Blood pressure, high blood pressure, yes. Age, the older the age, the higher the risk. Glycosylated hemoglobin. A glycosylated hemoglobin is what we measure to see what the blood sugar has been for the last 3 months. So if someone, it doesn't say they're diabetic, but if they have a high glycosylated hemoglobin, which is hemoglobin A1C, if they have a high A1C, we lower it. So diabetes is a risk factor for stroke. Family history of stroke, definitely a risk factor. Gender, men are higher risk than women, although it increases with women after they go through menopause. All right, so which of these are modifiable? They're all risk factors. Which ones are modifiable? Well, smoking is modifiable. Blood pressure is modifiable. Hemoglobin A1C is modifiable, and gender's not, and family history is not. So, okay, age, family history, and gender are not modifiable. A nurse is teaching a patient with hemianopsia following a stroke about ways to adapt to this visual deficit. Which of the following strategies should the nurse include? All right, you need to know what hemianopsia means. Hemianopsia is the loss of the visual field on one side or the other. So I've lost, if I have a stroke and I've lost this in this eye, I've lost the visual field this way. It means I have no peripheral vision in this eye, right? So they have hemianopsia. So what do we teach them to do if they've essentially lost their peripheral vision in one side? Turn your head from side to side when eating or walking. Well, that would help with your peripheral vision. Keep the room dimly lit to avoid eye strain. That doesn't help with peripheral vision. Wear the eye patch over the affected eye. Well, that doesn't help. That just removes all your vision, not just your peripheral vision. Use your unaffected eye for activities. Well, that doesn't help with your peripheral vision. You still lost your peripheral vision over on this side, right? So I need to turn my head from side to side when eating or walking. That's the correct answer for that. A patient with hemorrhagic stroke means they bled out, is admitted to the ICU. Which physician order should the nurse question? Keep the head of the bed elevated at 30 degrees. So if they're bleeding out in their brain and we keep their head of the bed elevated, that helps gravitationally. I suppose that would help. That just sounds like it makes sense to me. They're bleeding out in their brain. We keep their head elevated. That just makes sense to me. Administer antihypertensive medications to maintain systolic blood pressure below 140. So the interesting thing is about an ischemic stroke, because they're not getting ischemic stroke, clot, they're not getting blood flow to their brain. We actually keep their blood pressure higher with an ischemic stroke, but with a hemorrhagic stroke, we keep their blood pressure lower so they don't bleed out as much. So that makes sense that we would keep their blood pressure low. Start heparin at 1,000 units an hour. So heparin is going to cause it take longer to clot. Well, why would I want to take longer to clot when I am having a hemorrhagic stroke? That makes no sense. Monitor neurologic status every hour. That makes sense to me that we do that. So I want to know which order I should question. Well, I don't want to give something that's going to prevent clotting when they're having a hemorrhagic stroke. And this is a good clinical reasoning question. And it requires that you understand the word. So vocabulary. You have to understand what the words mean. And then you have to think about the implications of the treatments. Okay. So this is a very good clinical reasoning question. It's not necessarily something you memorize. Nobody said you need to memorize. Don't give heparin to a patient with a hemorrhagic stroke. That's not something you have to memorize. You have to think through it and say, this is not a good idea. Okay. During the acute phase of an ischemic stroke, the nurse notes the patient has difficulty swallowing. What is the most appropriate initial nursing action first? So what would I do first? Place the patient on NPO status and request a swallow evaluation. Well, if they're having trouble swallowing, it seems like getting a swallowing eval would be a good idea. Feed the patient thickened liquids to prevent aspiration. Well, if they're allowed to swallow, that's what I would want to do. Position the patient upright and offer small sips of water. I'm not happy with small sips of water, because that's a thin liquid. And if somebody's having trouble swallowing, I'm not sure I want it. I mean, I like sitting upright, but I don't like the sips of water. Insert a nasogastric tube for nutrition. I might have to, but the question says, what am I going to do first? So what do I need to do first? Well, I have to get a swallow eval. After I get the swallow eval, maybe I'm going to do thickened liquids. Maybe I'm going to put an NG tube down. I don't know what the swallow eval is going to tell me. So this is one of those times where the first tells me I have to do what I have to do first. So pay attention. That's a key word. That's a red flag word in the question. First is a red flag word. Make sure you pay attention to that word. A patient is receiving thrombolytic therapy for an acute ischemic stroke. Here we have vocabulary. Do you know what thrombolytic means? Thrombolytic means something to break up clots. Remember, heparin prevents clots from forming. Heparin is not a thrombolytic. Thrombolytic breaks up clots. It's a very high-risk drug. You give somebody a thrombolytic without careful monitoring, they could literally bleed out and die, right? So we're going to give them a TPA, thrombolytic, whatever, for an acute ischemic stroke. So it's a high-risk medication. Which assessment finding requires immediate action by the nurse? All right, and a mild headache. Mild headache, I don't know. That seems like a mild headache it's just a very vague symptom. There's nothing about a mild headache. Like if it said severe headache, I would be concerned about it, but a mild headache is very, very vague. Blood pressure of 160/94. So y'all, this is not a hemorrhagic stroke. This is a ischemic stroke. And actually, when someone's having an ischemic stroke, keeping their blood pressure a little bit higher actually has some benefits to it. So I'm not saying I wouldn't notify the healthcare provider. If I don't have any standing orders about blood pressure, I would notify the healthcare provider about this, but it's not really that concerning to me at the moment. Like it doesn't require immediate action. It would be more like next time I talk with them, I tell them about it. Nausea, again, a very vague symptom. Headache, nausea, very, very vague. Decreased level of consciousness. Y'all, that's a big time symptom. Decreased level of consciousness. It doesn't mean they fell asleep. Falling asleep is not a decreased level of consciousness. Decreased level of consciousness means I can't arouse them like I used to. Maybe they're barely arousable, right? So decreased level of consciousness is a major symptom that I need to take immediate action. Am I going to do anything about the headache or the nausea? Honestly, probably not. That's not that surprising. They're sick. They had an ischemic stroke. I'm not that surprised about it. And the blood pressure of 160/94, I'm not that concerned about because it's an ischemic stroke. If it was a hemorrhagic stroke, I would definitely be concerned about it. Of course, we wouldn't be doing thrombolytic therapy with a hemorrhagic stroke. A patient who suffered a left-sided, so left side, this is my left side, CVA, is being discharged home with right-sided hemiplegia. So that makes sense. Left-sided stroke, right-sided hemiplegia. Hemiplegia means weakness on one side. One side is half. Hemi is half. Plegia is weakness, right? So hemiplegia, which instruction is most important for the nurse to include in the patient's education plan. So when you see most important, you have to think best, which means I'm probably going to see more than one thing here that I would want to include in the education plan, and I have to choose which one is best. Okay, so let's read the answers. Use your left hand to perform daily tasks. Well, they have right-sided hemiplegia, so fine. We can do that. Install handrails on staircases and in the bathroom. Well, that's definitely important because I don't want them to fall. Attend social events to improve your mood. Maybe. It doesn't say anything about their mood. So I don't know how important that is. There's not enough information to choose C is what I'm saying. Limit fluid intake to reduce the risk of incontinence. No, we don't ever want to tell someone to limit fluid intake unless there's a reason for them that I would think they'd be fluid volume overloaded. So fluid volume overloaded may be a reason, but CVA is not fluid volume overload. So I'm crossing off C and D. So is it more important that I tell them to use their left hand to perform daily tasks like turn on the faucet with your left hand, pick up your cup with your left hand and drink? Okay, so that's using your left hand. Or install handrails on staircases and in the bathroom. All right, so this is the way you can figure this out. I would tell them to use their left hand to perform daily tasks, but I would not tell them to install handrails and staircases in the bathroom, which means they're at risk to fall. Or I would tell them to install handrails and staircases in the bathroom, but I would not tell them to use their left hand to perform daily tasks. Well, which one is more important? Which one says to the National Council of State Boards of Nursing, I'm a safe nurse? Y'all, I have to be safe. I have to make sure they don't fall. And they're going to use their left hand by default. Of course they will. Their right hand is weak. They're going to use their left hand by default. I don't have to tell them that. That's silly. All right. Which symptom is most characteristic of a left-sided cerebral stroke? So left-sided stroke. Neglect of the left side. No, because I would expect to have right-sided symptoms. Okay, so not neglect of the left side. Impulsive behavior. Maybe, but I think of impulsive behavior as frontal lobe, and they said left-sided. So I guess it could be the left side frontal lobe, but it didn't specifically say that. So I'm not thinking impulsive behavior. Aphasia, language difficulties. All right, aphasia, that's very common with a stroke. Is it more common on the left or the right? I don't know, but aphasia is a very common symptom. And if I'm going general, not specific, because if I say, well, I don't know specifically, but in general, aphasia is a problem. So I'm going to keep that on my list. Spatial perceptual deficits. Spatial perceptual deficits. So spatial perceptual deficits usually are a result of having a stroke on the non-dominant side. Okay, so if I'm right-handed, I'm dominant on my left side. If I'm left-handed, I'm dominant on my right. Does that make sense? If I'm right-handed, my left side is dominant. If I'm left-handed, my right side is dominant, okay? And spatial perceptual deficits are usually a result of a stroke on the non-dominant side. Now, they had a left-sided stroke. Now, we can say, I don't know which side is dominant. That's true. But in the majority of people, which side is dominant based on how many left-handed people there are in the world? Now, if you want to be non-majority, that's an awesome thing to be left-handed. My daughter's left-handed. She's non-majority. But the majority of people are right-handed. So the majority of people are left-sided dominant. So they had a left-sided stroke. So they would have had a stroke on the dominant side. So it's unlikely that it's a spatial perceptual deficit. So I'm going to go with the one that is most common across all types of strokes is aphasia. Very, very common deficit. One of the most common deficits that I've ever seen with a stroke. And this is what I recommend you doing when you don't know the answer. So I didn't think you would know the answer to this question. I didn't put this on here because, in fact, I didn't put it, it's not even in the blue book. Okay. I put this on here not to teach you that aphasia is a common symptom. I put this on here so that you can learn how to guess well. So when you don't know what the answer is, think generally. Don't pick the most remote option. Don't go, well, it could be impulsive behavior. Well, how many people with strokes have you found that impulsive behavior is their symptom? Not very many. Okay, then why are you picking it? Don't pick it. Say in general, what is most common? You want to pick that answer. The nurse is providing discharge instructions to a patient who had a TIA, transient ischemic attack. Which medication should the nurse anticipate will be prescribed to prevent future strokes? TPA, which is a thrombolytic, warfarin, which is an anticoagulant, aspirin, which is an antiplatelet, or alteplase, which is also a thrombolytic. So I have two thrombolytics, so I'm going to cross them off because I'm not a prescriber. It would not be appropriate for me to choose between them. So when you have two of the same answers and it's a single choice question, neither one of them is right. Okay. So I'm crossing off A and D. So would they be more likely to be on warfarin or aspirin? So if you don't know this, aspirin is the most common thing that's used to prevent strokes and heart attacks. So aspirin it is. Most common medication used to prevent strokes and heart attacks. If you're over the age of 50, probably should take an aspirin a day. Just take a baby aspirin a day to prevent heart attack or stroke. I'm over 50 and I'm not doing that yet. So I'm not preaching at you, y'all. Preaching to myself. A patient with hyperlipidemia experiences sudden vision loss in one eye and transient difficulty speaking that resolves after 15 minutes. What is the priority diagnostic test? Electrocardiogram, carotid Doppler, echocardiogram, or MRI of the brain. So I would think that a CT of the head without contrast would be my priority. However, that's not here. Remember, the right answer is the right answer because of the other answers. So when the answer you're looking for is not there, don't say to yourself, well, I don't know then. No. Just say, okay, there's something else they want me to do. So what are we trying to do? So it's a TIA. It's not an actual stroke. It's transient. So do we need to check out the heart? Well, no, we really don't need to check out the heart. We're pretty sure it's a stroke-like symptom, right? So why do the heart? So we're going to cross off A and C because those are heart tests. So I'm crossing off A and C. So I could check the carotid artery to see if there's a clot in there, like partial, maybe it's occluding at say 85, 90%. That's a carotid Doppler could tell me that, or an MRI of the brain. So MRI of the brain is okay to do, but it's not standard of care. So I'm not going to go off the reservation and order some crazy test that's not standard of care. But I do know carotid Doppler ultrasounds are very common to look for clots in the carotid artery. And if they're having a TIA, it's unlikely it's a hemorrhagic stroke. Remember, hemorrhagic strokes they bleed out, they have the stroke, and there's not a lot we can do about it. Whereas embolic and thrombotic strokes are more often have transient symptoms, right? So that's why we say it's a precursor to the stroke because they've got a clot in there. It's probably 98, 99% occluded. They have these kind of transient symptoms until finally something comes along and blocks it off completely. And so if we want to look for a clot, we want to look in the carotid artery. So it's really a good idea to do a carotid Doppler ultrasound. That's where we just do an ultrasound of the carotid artery to see what's going on in there, okay? The nurse is preparing to educate a patient with expressive aphasia about post-stroke exercises. Which communication strategy is most appropriate? So don't be confused. This isn't about post-stroke exercises. It's about how to communicate the post-stroke exercises to them. Okay, they have expressive aphasia. They can understand what I'm saying. They have trouble communicating back to me. Speaking loudly and slowly. They're probably going to go, I can understand you just fine, lady. Why are you speaking loudly and slowly? Okay, so probably not. Using simple pictures and gestures. So they can understand what I'm saying, but in order to communicate back to me, it's going to be hard. So if I'm using simple pictures and gestures, they may be able to replicate those or duplicate those or use the picture to express to me what they're trying to say. So that may be an option. I don't know. I haven't heard of this as an option before, but it makes sense to me. That could be one way. Providing written instructions. So that's good, but it doesn't give me any idea of how they're understanding. Providing written instructions doesn't tell me if they're understanding it, but we'll keep it on the list. Asking open-ended questions. All right, that's not good because that requires them to communicate a lot to me. So I'm crossing off A and D. So do I want to use, I'm going to use simple pictures and gestures, but not provide written instructions. Or I'm going to provide written instructions, but not use simple pictures and gestures. So we're looking for a communication strategy. Providing written instructions as a standalone doesn't seem like a good communication strategy. Just send them an email. Yeah, we're not doing any teaching today. Check your email. Okay, no. So it would seem like using simple pictures and gestures out of these options would be the best option. Remember, the right answer is the right answer because of the other answers. Now, if you didn't get this right, if you're like, Sharon, I disagree with you. Okay, you can disagree with me if you want to. I'm just telling you that you're going to get questions like this on the NCLEX, that there's no obvious right answer. And you're going to have to use your clinical reasoning and strategies to figure out what's best. And this is a best question. And when you get a best question, there's almost always two, and you're trying to choose between them. Okay. And you're trying to figure out how to do that. So I'm teaching you how to do that. A patient with right-sided hemiplegia, that's half of the body is weak, is learning to dress independently. Which instruction should the nurse provide to facilitate this activity? Independent dressing. Dress your affected side first. So let's say they have right-sided hemiplegia. So this is my affected side. So dress, here's my good arm, dress your affected side first, and then your unaffected side. So that makes sense to me. Affected side first, unaffected side. That makes sense. Always have someone assist you with dressing. Well, y'all, that's not independent dressing. We're trying to do independent dressing. So I'm not going to tell them to have someone assist them. Wear clothes that fasten in the back. That doesn't make any sense. Start dressing with your unaffected side first. So if I do my unaffected, this is my unaffected side. So if I get, that's going to be hard because I can't hold it or anything. But like, okay, I try to get my arm in, right? I'm like, okay, I finally got it on. All right, now how am I going to get my other arm? That doesn't make any sense. So it seems like I should dress the affected side first and then the unaffected side. Which of the following is an appropriate nursing intervention to promote skin integrity in a patient with hemiplegia? All right, skin integrity. So they have weakness on one side. Position the patient in a wheelchair all day to prevent pressure ulcers. Well, that doesn't make much sense. You want to move them around. Encourage the patient to perform active range of motion exercises on the effective side. Well, that's impossible. Well, maybe it's not impossible. Maybe they're weak, but like that's not going to promote skin integrity. It may affect muscle strength, maybe if they can even do it. Reposition the patient every 2 hours when in bed. Well, that's promotes skin integrity. Massage reddened areas to improve circulation. So we don't massage reddened areas. I don't know if you know that's a standard of care. We don't massage reddened areas. We just get off of the reddened area. Y'all, I'm showing you this because I want you to know the fundamental principles. We turn people every 2 hours. That's a fundamental principle. And having someone with hemiplegia, this is like a placeholder. They could have said they're unconscious. They could have said they're on the ventilator. They could have said they have a broken leg. They could have said they have hemiplegia, any of these things. And in order to promote skin integrity, the right answer is still turn them every 2 hours. So don't throw away those fundamental things that you know are always good things to do. Always wash your hands. Always turn people if they can't turn themselves, right? So these are things that you need to kind of keep in mind and remember as you're taking the NCLEX and you're like, what is the best answer? You know what the best answer probably is? Some fundamental principle that you've always known. And it's also true here. The nurse is teaching a patient with hemianopsia. Remember what that is? Taught you what it was. Hemianopsia is where you lose visual field in one side or the other. The nurse is teaching a patient with hemianopsia how to prevent unilateral neglect. The nurse is teaching a patient with hemianopsia how to prevent unilateral neglect. So let's say I've lost visual field here, and so maybe I don't really look at this side of my body, right? I don't ever look at it. So maybe I knocked it against something and it's bleeding and I didn't notice it. Which statement indicates that the patient understands the teaching? I should avoid moving items to my affected side. I should avoid moving items to my affected side. Well, maybe. I need to remind myself to look toward my weaker side. Well, that's true. I need to remind myself to look towards my weak side. This is the side I can't see, so I better look this way. It's best if I turn my chair away from my weaker side. Well, that doesn't make any sense. I will wear a blindfold over my stronger eye. Okay, that doesn't do anything. It's not like if I close my good eye, all of a sudden I'm going to have vision. No, that's not how that works. Okay. So do I want to avoid moving items to my affected side, or do I want to remind myself to look towards my weaker side? So I put this on here because I want you to know that someone who has hemianopsia, the key thing is to tell them to turn their head side to side. That's the key teaching. Survey your weak side, survey your field so that you don't miss anything because you don't have any vision on this side of your head. Okay. And so whether it's phrased like turn your head from side to side, or whether it says look to your weaker side, they both mean the same thing and they're both the right answer. For a patient with hemiplegia, which instruction is essential to include in the patient teaching to prevent shoulder subluxation? Hemiplegia. So let's say I have right-sided weakness. Let's say my right arm is weak. So what is shoulder subluxation? It's where it's like a shoulder droop and it can actually get out of alignment because of that. So if I have right-sided weakness and I can't hold my arm up, if it hangs like that too much, it can come out of joint. That's what subluxation is. Use the overhead trapeze to position yourself in bed. I mean, maybe. I don't know how that's going to help this side from subluxation. Avoid moving your affected arm to prevent pain. That's not a good idea. You don't want to avoid moving an arm. It's just going to get contracted up. Support your affected arm with a sling when ambulating. So if I keep my arm up, because see, when I'm laying down or I'm in a wheelchair, I can keep my arm supported. But if I'm walking, my arm may have a tendency to hang down, but if I keep it in a sling, that's going to keep it elevated. So that's a good idea. Perform passive range of motion exercises only on your unaffected side. Well, that's silly. Why would I do passive range of motions on my unaffected side? That doesn't make any sense. So if I'm trying to prevent subluxation, which is kind of dislocation of this shoulder, then putting it in a sling and not allowing it to hang down like that seems like a good idea. So that's the best option here. A patient with a CVA has homonymous hemianopsia. Which patient education point should the nurse emphasize to promote safety? Place frequently used items on your affected side. Avoid wearing glasses to reduce visual field distractions. Limit movement to prevent disorientation. Scan your environment by turning your head side to side. All right, I know you know what the answer is to this, but you may be distracted by the word homonymous. So I'm going to teach you a testing strategy that I want you to remember. When you get a question like this, where it has one word in it that you don't know what it means, ignore that word. Let's pretend the word homonymous is not even there. A patient with a recent CVA has hemianopsia. Which patient education point should the nurse emphasize to promote safety? Now, you know what to do for hemianopsia. This is our third hemianopsia question. You know you have to turn your head side to side and scan it. So, well, but it says homonymous. Okay, homonymous means both eyes have lost visual field on one side. That's all it means. It means both eyes, instead of just one eye losing visual field, both eyes have lost visual field on one side. So you do the same thing. Y'all, hemianopsia, you scan your visual field, right? You have to turn your head side to side. Now, I want you to remember this rule that I just taught you. If you don't know what one word means, ignore that word and answer it. Answer the question based on what you do know. You know the word hemianopsia. You don't know homonymous. So ignore homonymous and say, I know what to do for hemianopsia, and I'm going to answer it based on that. Could you get it wrong even if you do that? You could. But y'all, it's about an 85% chance you're going to get it right. That's what I want you to remember. That's a really, really, really important testing strategy. I don't talk about it a lot. I don't have a lot of chance to do it. I don't give a lot of questions where the clearly a word that we don't know what it means is, but I want you to remember that. So I hope this was helpful to you. And I hope you have a great rest of the day or week or weekend or whenever you're watching this. Y'all, thanks for being a part of the Clinic Review family. We love you. Bye.